Science Journal for Kids and Teens presents How Can We Relax COVID-19 Restrictions? Adapted from the original peer-reviewed paper in the journal The Lancet, published on October 27, 2021. Research conducted by Raphael Sonnabend, Lilith Whittles, Natsuko Amai, and others from the MRC Center for Global Infectious Disease Analysis at Imperial College London. See the full list of authors in the accompanying PDF. Read by Miranda Wilson. Abstract. COVID-19 has changed everyone's lives. At one time or another, most of us have had to stay at home and socially distance ourselves from others. But in some countries, people are starting to get out of lockdowns. The last lockdown in England started in January 2021. Relaxing the restrictions afterwards happened gradually. It depended mainly on the number of immune people. Was this a good strategy? We created a mathematical model to see if lifting the restrictions was well timed. The strategy was successful at first, but the emergence of the Delta variant changed things. Our model shows that vaccination alone may not be enough to stop another peak of hospitalizations and deaths. Introduction. COVID-19 has been around us for almost 2 years now. Many of us had to stay at home during the lockdowns. As you probably remember, the restrictions were very strict at first. Then governments started lifting them step by step. What's the reason behind all this? SARS-CoV-2, the virus that causes COVID-19, spreads fast. If people interact with each other less often, it is more difficult for the virus to spread. This way, not only do we protect ourselves and our families, but we also make it easier for the healthcare system. If too many people get sick at the same time, the hospitals will be too full and many people won't receive adequate medical care, and not only for COVID-19, but for every other disease as well. Vaccinating as many people as possible and lifting the restrictions step by step makes sure this doesn't happen. Little by little, we return to our social lives, while hospitals don't get overwhelmed. But how do governments decide when it's time to loosen the restrictions? Governments track how many people get infected and how many are in hospitals. Now that we have available vaccines against the virus, safely lifting the restrictions is also related to vaccine coverage. There are many people who have natural immunity as well, after recovering from COVID-19. Another thing governments need to consider is the appearance of new variants. Some spread faster, or vaccines don't work as well against them. So, has England's strategy of lifting restrictions been successful so far? COVID-19 vaccines can help prevent people from getting severely ill. In this picture, the person on the left is receiving their COVID-19 vaccine from a medical professional. Methods. We studied the situation in England. In January 2021, the government announced a full lockdown. Later, there were 4 steps of lifting restrictions. 1. Reopening schools in early March and allowing small groups to meet outdoors in late March. 2. Reopening hairdressers, museums, restaurants, outdoors, and other shops in April. 3. Allowing gatherings of small groups indoors and reopening outdoor venues for sports and large concerts in May. 4. Lifting all restrictions in late June, but the emergence of the Delta variant delayed this step until late July. Was this timeline right? Was the delay in step 4 necessary? What will happen from now on? We created a mathematical model to assess the impact of each step and explore what the epidemic in England might look like in the future. The model took into account the daily number of cases and hospitalizations, the vaccine coverage at each step, the number of people who are protected with natural immunity after recovering from COVID-19, how effective vaccines are, the emergence of the Delta variant, which spreads more easily, and how much people socialized before restrictions were lifted and how they might socialize after. The model tested many different scenarios because we cannot know for certain how people will mix in the future, and there are a lot of unknowns about the new variant. First, natural immunity from a previous infection with another variant might not protect so well against Delta. Second, vaccines seem to be less effective against Delta. Every virus, including the one that causes COVID-19, has an R number, or reproduction number. R shows, on average, how many susceptible people one infected person spreads the virus to. The R number needs to stay below 1 to lift restrictions. This means the epidemic is shrinking. We used our mathematical model to calculate R over time in each scenario. Results. Many of the results can be seen in Figure 1, which we'll go over in detail in a moment. Our results showed that the reopening of schools, Step 1, didn't lead to an increase in cases. The reproduction number R remained below 1 even after Step 2 in April. But this is when the Delta variant emerged. Soon it became the most common variant, and the R number increased above 1 in May. Cases increased rapidly because Delta spreads more easily. In Step 3, the stadiums reopened. The European Football Championship in June also meant more people were socializing. Cases increased more. Here in Figure 1, you can see a graph showing how the virus reproduction number R changed between December 2020 and July 2021. The shaded areas around the line for R show uncertainty. The gray areas on the graph show the winter and spring school holidays. The graph shows reproduction number R on the y-axis and time on the x-axis. As you look at Figure 1, see if you can determine which events led to the greatest increase in R. The first half of the graph represents time when only one variant of the virus was present, while the second half represents the additional introduction of the Delta variant. The dashed line indicates when the reproduction number is 1. Remember, when R is below 1, the epidemic is shrinking, and when it's above 1, the epidemic is growing. In the graph, you can see that R stayed below 1 from January through April 2021. Following that, you can see R increasing when the Delta variant became more common in May, and when there was increased socialization with the European Football Championship in June. As a result, the government decided to delay Step 4 until late July. This delay gave millions more people in England the chance to get vaccinated. Our model shows that this vaccination prevented thousands of hospitalizations. It also reduced the predicted total deaths by 15%. If the Delta variant hadn't shown up, the R number would have remained below 1. What about future projections? Uncertainty about vaccine efficacy and people's behavior means that there are many different possible developments in the epidemic. Discussion. Our study shows that lifting the restrictions step by step has been a successful strategy. Hospitalizations and deaths have been low throughout the spring and summer. Mass vaccination has been the main reason behind this. The time between each step allowed for the administration of millions of vaccines, and if more people are immune to the virus, it is more difficult for it to spread. But the emergence of the Delta variant has made things difficult. It spreads better than the older variants, and vaccines and natural immunity are not so protective against it. But that doesn't mean that they don't work. It means that vaccination alone may not be enough. There may still have to be some restrictions to avoid further healthcare system overload and to save many lives. The delay of Step 4 and its benefits demonstrates that. Conclusion. Lockdowns and restrictions are hard on everyone, but they are there to protect you and countless others. Moreover, COVID-19 has affected older people more until now, but the new variant is common among children and teenagers. To avoid getting infected or infecting others, get vaccinated when or if you are offered a vaccine. Wash your hands often with soap. Wear a face mask in indoor public places. If possible, keep a physical distance from your peers and avoid crowded places. Alternatively, get a free COVID-19 test before gathering with lots of people. Thank you for listening to this recording. Visit our website, sciencejournalforkids.org, for more free science teaching resources.